While diet alone may not be enough to completely treat shoulder pain, there are certain dietary changes you can make that may help alleviate the symptoms associated with shoulder pain. Here are some tips. Increase your intake of anti-inflammatory foods. Eating foods that have anti-inflammatory properties can help reduce inflammation in the body, which can be a contributing factor to shoulder pain. Examples of anti-inflammatory foods include fatty fish like salmon, nuts and seeds, fruits and vegetables, whole grains, and herbs and spices like turmeric and ginger. Avoid foods that can cause inflammation. On the flip side, there are certain foods that can contribute to inflammation in the body, so it's best to avoid them if you're experiencing shoulder pain. Some of these foods include processed foods, sugar, refined carbohydrates, and trans fats. Stay hydrated. Drinking enough water is important for keeping your joints lubricated and reducing pain associated with movement. Aim to drink at least 8-10 glasses of water per day, and more if you're physically active. Incorporate foods high in vitamin C. Vitamin C is important for collagen production, which is essential for healthy joints. Eating foods that are high in vitamin C, such as citrus fruits, berries, kiwi, and bell peppers, can help support joint health. Consider supplements. In addition to dietary changes, certain supplements may also be beneficial for reducing shoulder pain. For example, omega-3 fatty acid supplements have been shown to have anti-inflammatory properties, and glucosamine and chondroitin supplements may help support joint health. It's important to note that if you're experiencing persistent shoulder pain, it's best to consult with a healthcare professional for a proper diagnosis and treatment plan.